Welcome to today's video about 8 shocking side effects of beetroot. Walk into any health food store and you'll see beetroot everywhere. Powders, juices, supplements, all promising incredible health benefits. Social media influencers swear by it. Fitness enthusiasts gulp down beetroot shots before workouts, and nutritionists praise its blood pressure-lowering effects. But here's what nobody talks about. This vibrant superfood has a dark side that could be silently sabotaging your health. The problem with our modern approach to nutrition is our tendency toward extremes. We label foods as either miraculous or toxic, completely ignoring the nuanced reality that even the healthiest foods can cause problems for certain people. This black and white thinking, rooted in our brain's desire for simple answers, often blinds us to important warning signs our bodies are sending. What makes this particularly dangerous is our psychological attachment to foods labeled as superfoods. Once we categorize something as universally healthy, we develop a cognitive blind spot that prevents us from questioning its effects on our individual health. This phenomenon, known as confirmation bias, leads us to ignore contradictory evidence while amplifying information that supports our existing beliefs about healthy foods. The wellness industry capitalizes on this by creating compelling narratives around certain foods, making it harder for us to think critically about their potential downsides. Today, we're exposing 8 shocking side effects of beetroot that the wellness industry doesn't want you to know about. These aren't rare reactions. They're real, documented effects that could be affecting millions of people who believe they're making healthy choices. From kidney stones to dangerous blood pressure drops, these side effects reveal why even superfoods require careful consideration and why one-size-fits-all nutrition advice can be dangerously misleading. Now let's dive into the side effects of beetroot, beginning with the first one: beeturia. The first time you notice pink or reddish urine after eating beetroot, your mind might race with worry. This phenomenon, called beeturia, affects 10 to 14% of people, and while generally harmless, it's actually your body sending an important message you might be missing. Beeturia occurs when battling pigments pass through your system unchanged instead of being broken down by stomach acid and digestive enzymes. The fascinating part? This effect is significantly more common in people with iron deficiency anemia, a condition affecting 1.6 billion people worldwide, nearly a quarter of the global population. The connection lies in stomach acid production. People with low iron often have reduced gastric acid, compromising their ability to break down these vibrant compounds effectively. Our brains tend to dismiss unusual bodily signals as quirky side effects rather than investigate deeper. This tendency to normalize the abnormal, called habituation in psychology, can cause us to miss valuable health insights. Recurring beeturia could indicate underlying iron deficiency, low stomach acid production, malabsorption issues, or digestive inefficiencies that might otherwise go unnoticed for years, silently affecting nutrient absorption and overall health. The inconsistency of beeturia makes it even more intriguing. You might experience it one day but not the next, depending on hydration levels, gut bacteria composition, or food preparation methods. Raw beetroot contains significantly more intact pigments than cooked varieties, increasing the likelihood of beeturia by up to 40%. This variability often leads people to dismiss it entirely, missing important clues about their digestive health and iron status. Next, number 2. Kidney stone formation. Risk. Beetroot's high oxalate content creates a hidden danger for kidney stone formation that most health enthusiasts never consider. These compounds bind with calcium to form calcium oxalate crystals, the foundation of 75% of all kidney stones. The process is insidious. Oxalates accumulate in your urine and crystallize over weeks or months without warning signs. The psychological trap here is the health halo effect, where our brains automatically assign positive attributes to foods marketed as healthy. Because beetroot is heavily promoted as a superfood, our minds categorize it as universally beneficial, making us less likely to question potential downsides. This becomes particularly dangerous for people with hyperoxaluria or digestive disorders like Crohn's disease. Kidney stones affect approximately 1 in 10 people during their lifetime, with recurrence rates reaching 50% without proper dietary modifications. Yet most don't realize their carefully curated healthy diet might be contributing to the problem. The stealth nature of stone formation means you could be unknowingly feeding the problem for months while experiencing no symptoms until stones begin moving through your urinary tract, causing excruciating pain that often sends people to emergency rooms. Regular beetroot juice consumption amplifies this risk significantly. Juicing concentrates oxalates while removing protective fiber, creating oxalate loads 3 to 4 times higher than whole beetroot consumption. The prevention strategy involves strategic pairing. Consuming beetroot with calcium-rich foods during meals allows calcium to bind with oxalates before absorption, reducing kidney stone risk by up to 60%. Cooking also reduces oxalate content by 20 to 30%. Next, number 3, dangerous blood pressure drops. Beetroot's celebrated blood pressure-lowering effect can become a serious liability for certain individuals. The nitrates convert to nitric oxide, dilating blood vessels and reducing blood pressure. Beneficial for hypertensive people, but potentially dangerous for those with low blood pressure or taking antihypertensive medications. The more is better fallacy drives many people to consume large amounts of beetroot juice, assuming greater benefits. This becomes problematic when blood vessels dilate excessively, triggering dizziness, severe fatigue, lightheadedness, and potentially dangerous fainting episodes. Older adults and those with autonomic nervous system disorders like dysautonomia face particular risks. Athletes using beetroot for performance enhancement sometimes report feeling lightheaded during workouts, especially those with naturally low baseline blood pressure readings below 90/60 millimeters of mercury. The additional vasodilation can disrupt cardiovascular balance during physical exertion, creating dangerous situations during training or competitive events. Postural hypotension. Sudden blood pressure drops when changing positions become significantly more problematic with regular beetroot consumption. This condition increases fall risk and potential injury, particularly concerning for elderly individuals. The challenge is that symptoms like persistent fatigue and dizziness are often attributed to stress, inadequate sleep, or aging rather than dietary factors, leading to continued consumption while seeking solutions elsewhere. Next, number 4. Digestive system disruption. Beetroot contains FODMAPs, fermentable compounds that can wreak havoc on sensitive digestive systems. For the 10 to 15% of people with irritable bowel syndrome, these compounds ferment rapidly in the gut, producing excessive gas and drawing water into intestines, leading to severe bloating, cramping, urgency, and diarrhea. The psychological conflict arises when a food marketed as gut-healthy causes digestive distress. This creates cognitive dissonance, leading people to blame other factors while the real culprit remains hidden. Raw beetroot is particularly problematic due to higher FODMAP concentrations, making fresh salads and cold-pressed juices especially troublesome for sensitive individuals. Small intestinal bacterial overgrowth compounds this problem significantly. In SIBO patients, bacterial fermentation begins earlier in the digestive tract rather than in the large intestine where it normally occurs, causing more severe and prolonged symptoms that can last for hours or even days after consumption. The bacterial overgrowth creates an environment where even small amounts of FODMAPs trigger disproportionate digestive distress, making portion control absolutely crucial. The concentration of problematic compounds is highest in raw preparations, ironically the forms often promoted as most nutritious. This creates conflict between perceived optimal nutrition and actual digestive tolerance. Cooking breaks down some FODMAPs, making beetroot more digestible. Pairing with gut-soothing ingredients like ginger or lemon can help minimize digestive disruption while maintaining nutritional benefits. Next, number 5. Iron and copper metabolism. Imbalance. Beetroot's vitamin C content dramatically enhances iron absorption, making it therapeutic for iron-deficient individuals but dangerous for those with iron overload conditions. This same property that helps anemic people can accelerate serious organ damage in those with hemochromatosis, a genetic condition causing excessive iron absorption. Hemochromatosis demonstrates how beneficial nutrients can become toxic accumulations when the body's regulatory mechanisms malfunction. The body stores excess iron in vital organs, including liver, heart, and pancreas, eventually causing life-threatening complications like cirrhosis, heart rhythm disorders, diabetes, and severe joint pain. The condition's silent progression makes it particularly dangerous. Early symptoms like chronic fatigue, muscle aches, and joint stiffness are so common and nonspecific, they're usually attributed to stress, poor sleep, or normal aging processes. Optimism bias plays a significant role here. People tend to underestimate their risk for genetic conditions, preventing those with family histories from taking appropriate precautions or seeking early testing despite this condition affecting approximately 1 in every 200 to 300 people of Northern European descent. Beetroot's iron-enhancing properties become problematic when combined with other iron-rich foods or supplements. Vitamin C can increase iron absorption by up to 4 times, turning moderate iron intake into potentially dangerous levels for susceptible individuals. This multiplicative effect is rarely considered when designing diets around multiple healthy foods. The timing of consumption matters significantly. Eating beetroot with iron-rich meals creates synergistic effects that maximize absorption, therapeutic for anemic individuals, but potentially accelerating organ damage in those with undiagnosed iron overload conditions. Next, number 6. Blood sugar fluctuations. Beetroot's natural sweetness surprises people who assume all vegetables minimally impact blood sugar. 1 cup of beetroot juice contains approximately 20 grams of natural sugar, equivalent to a medium banana. While naturally occurring, the body's glucose response doesn't distinguish between natural and added sugars, especially when fiber is removed through juicing. The health halo effect becomes particularly relevant here. Categorizing beetroot as a superfood leads to consumption of larger quantities or concentrated forms like juice, inadvertently creating glucose challenges. Marketing messages promoting beetroot juice as a health elixir encourage consumption patterns that might not align with individual metabolic needs. For people with type 2 diabetes or prediabetes, beetroot's concentrated sugar content can complicate glucose management, especially when consumed regularly or combined with other carbohydrates during meals. Rapid sugar absorption from juice creates glucose spikes requiring substantial insulin responses, potentially undermining long-term metabolic health goals and blood sugar stability that diabetics work hard to maintain through careful dietary planning and medication management. The paradoxical nature of beetroot's blood sugar effects adds complexity. Research suggests certain compounds like alpha-lipoic acid may improve insulin sensitivity over time, but immediate glucose impact can work against these potential benefits. Individual variation in glucose response highlights the importance of personalized nutrition approaches, as factors like gut microbiome composition and insulin sensitivity significantly influence how beetroot affects blood sugar levels. Next, number 7. Masking serious medical conditions. Beetroot's red pigments can create dangerous medical masking effects, potentially delaying diagnosis of serious gastrointestinal conditions. When betalain pigments pass through the digestive system, they create red stool coloration closely mimicking blood, a phenomenon called false hematochezia. This becomes concerning considering colorectal cancer is the 3rd most common cancer worldwide, often presenting with subtle symptoms including stool color changes or occasional blood streaks. The tendency to attribute unusual symptoms to recent dietary choices can delay medical consultation, missing critical early detection windows when treatment outcomes are most favorable and survival rates are highest. Our brain's pattern recognition system works against us here. Seeing red stool after eating beetroot naturally leads to dietary attribution, creating false reassurance. This can persist even when coloration continues beyond expected beetroot elimination timelines, potentially masking ongoing bleeding from ulcers, inflammatory bowel disease, or malignancies. The masking extends beyond colorectal issues to bleeding from various gastrointestinal sources, including stomach ulcers, anal fissures, and hemorrhoids. While seemingly less serious than cancer, these conditions require appropriate medical attention to prevent complications. Healthcare providers face challenges when patients don't disclose recent beetroot consumption during consultations. Red coloration can lead to unnecessary panic, expensive testing, or delayed recognition of dietary causes. Cognitive anchoring plays a role. Once people establish the beetroot red stool connection, they may dismiss future instances even without recent consumption, creating a dangerous false sense of security. Next, number 8. Medication interactions and contraindications. Beetroot's ability to interact with medications represents perhaps the most overlooked yet serious concern. The compounds providing health benefits can interfere with drug metabolism, absorption, and effectiveness, creating unexpected therapeutic challenges. Beetroot's high nitrate content can interact dangerously with nitrate-based heart medications. When dietary nitrates combine with pharmaceutical nitrates, resulting vasodilation can become excessive, leading to severe hypotension, dizziness, and cardiovascular complications. This interaction is concerning because both food and medication are intended to support heart health. Blood-thinning medications present another concern. Beetroot contains compounds affecting blood clotting mechanisms, potentially enhancing anticoagulant effects of drugs like warfarin, rivaroxaban, or dabigatran. This interaction increases bleeding risk and complicates the therapeutic balance healthcare providers work to maintain in patients requiring anticoagulation therapy for conditions like atrial fibrillation or previous blood clots. The psychological barrier to recognizing food-drug interactions stems from compartmentalizing natural foods and pharmaceuticals as separate categories. This mental separation prevents people from considering how dietary choices might influence medical treatments, leading to unreported interactions and suboptimal outcomes. Beetroot's impact on stomach acid production affects medication absorption, particularly drugs requiring specific pH levels for optimal bioavailability. Medications for osteoporosis, certain antibiotics, and thyroid disorders can all be affected by gastric acidity changes, potentially reducing effectiveness. The timing of consumption relative to medication administration becomes crucial, yet many people remain unaware such considerations exist. Next, safe consumption guidelines and conclusion. Understanding these side effects doesn't mean eliminating beetroot entirely. It means approaching it with informed awareness. For most healthy adults without specific contraindications, half to 1 cup daily, raw, roasted, or steamed, represents safe, beneficial consumption. Juice intake should be limited to 100 to 150 milliliters daily, preferably combined with lemon or ginger for enhanced digestibility and additional protective compounds. The key to safe beetroot consumption lies in mindful awareness and self-monitoring. Pay attention to how your body reacts, especially with pre-existing conditions, medications, or unusual symptoms. Start with small portions, perhaps a quarter cup, and gradually increase while monitoring your body's response. Avoid pairing with high oxalate foods like spinach, nuts, or chocolate if prone to kidney stones, and consider cooking rather than raw consumption for digestive sensitivities. Most importantly, maintain open communication with healthcare providers about dietary habits, including regular beetroot consumption, especially if taking medications or managing chronic conditions. This transparency can prevent dangerous interactions and help optimize both nutrition and medical treatments for the best possible outcomes. Knowledge empowers better choices, and understanding these potential risks allows you to enjoy beetroot's benefits while protecting your health. Remember, personalized nutrition is far more effective than following generic dietary advice that doesn't account for your unique health profile and individual needs. Your genetic makeup, existing health conditions, medications, and even gut microbiome composition all influence how your body responds to foods like beetroot. Prevention starts with awareness. And every small change you make today adds up to a healthier tomorrow. If this video was helpful, kindly type yes in the comment. That motivates us to produce more content like this. Don't forget to like this video if you found it informative, share it with someone who might benefit from this knowledge, and subscribe to our channel for more science-backed health insights. Thank you for taking the time to educate yourself about complete nutritional understanding. Your body and your future self will thank you for it.